We're going to take up the ECG matching activity. So let's just get this party started. The first one. All right, so along here, what you're going to see is this very low voltage. Now, this is kind of hard to tell because you can't compare it to other EKGs at the same time, but these peaks aren't even reaching that first thick line. So this is really low voltage all the way across. All right, so normally you would have a peak that goes up here. This is below that first line. We've got low voltage all the way across. So this would be H. This one's going to be if somebody has emphysema. So if you remember with emphysema, your lungs are going to be thickened with scar tissue. And remember, the electrodes are on the outside and they're trying to get the electrical activity that's traveling through the bone and the muscle and the fat in the skin from the heart. So if you've got a lot of scar tissue around the outside, it's going to be really difficult for that electrical signal to get through to the electrodes. Now the second one here, this one, if you just take a look at this doesn't make any sense at all. It's unorganized, it's chaotic. You know, we've got some little hills here and then we've got a little blah down here. It just looks crazy. So there's no real rhythm to it. You don't see a nice QRS curve at all. It's uncoordinated, it's chaotic. You don't see any clear waves. You don't see a nice P wave or a nice T wave. You don't get any QRS complexes as you go along here. It's just a complete mess. So this is going to be F. Now this, you really don't want to have this on your EKG chart because this is going to be your ventricular fibrillation or your V-fib, you'll hear people say. This is when the ventricles are fibrillating completely out of control. Remember how big those ventricles are, and remember they've got the bundle of His and those bundle fibers going down that's trying to make sure the electrical signal gets passed through the ventricles all exactly at the same time. So if we've got parts of the ventricles that are contracting different from different parts of the ventricles, we're going to get no blood flowing through the body at all. So somebody would come in obviously experiencing chest pain. Eventually they would lose consciousness, and this is because of the blood flow to the heart or even out of the heart. Probably should say out of the heart. So we have no cardiac output, so the blood is not leaving. The person would have no pulse. The person would stop breathing, and this is a case where you need to have the defibrillator being used. So the next one here, this looks beautiful. We get nice little P waves here. We have a nice QRS complex. We have a nice, T wave there. And then look at this, nice and regular as we go along. It doesn't look chaotic. It looks calm, cool, and collected. Right? So we're going to figure out what the heart rate is as we go along here, just for the fun of it. We're going to start here as our starting point. This label here is going to be our 300. I know this is kind of over. It's just how the numbers were adjusting as I was trying to put them in there. 150 is our next line, 100 is our next line, and 75 is here. So look at our nice heart rate, right? 300, 150, 100, 75. So just a little bit below 75, maybe around 74-ish beats or so. All right, so this is A. This is our normal sinus rhythm. Just looks calm, cool, collected, no problem here. Now our next one, if you take a look at this here for number 4, again, this look at nice and normal, just normal P waves, normal QRS, normal, T wave, just a little bit, calmer than the other one, but still not too bad. So let's take a peek here and look at what the heart rate is, because this is going to be a normal rhythm. We got a nice normal rhythm here. So there's really nothing wrong with this person, but we want to just double check and see what the heart rate is. So we're going to start, I started this with this one here. I could have started down here. This one's actually a little bit closer to the dark line, but I started it here. So this is going to be our starting point. We're going to label this next line as 300. Our next line is 150. Our next line is going to be 100. So we're here with 100, but we haven't reached our next, our peak. So we're going to label here as 75. This one is 60. and this one is 50. So this person is just below 60 beats per minute. It's really not that bad. It's probably about 50, I don't know what we'd say, about 57-ish there. So a little bit of bradycardia there. So that would be our answer for B. So this is our sinus bradycardia. We're just going to say it's sinus because it's got a normal, nice little normal rhythm that starts at the sinoatrial node. And this one here is about 57 beats per minute. So our next one here, anyway, sorry, forgot about this part. So this could be somebody who's really athletic that has a low resting heart rate. This could be somebody who's on something like those beta blockers that just slows down your heart rate. This could be somebody who's hypothermic, so even though we might be thinking, oh, nice and calm, actually the person's freezing to death. Or it could be somebody who's having heart failure. All right, this one we look at, this one is like frantic, but again, it's pretty rhythmic, right? It's about every 2 we get a heartbeat as we go along here. We do get a P wave, we got a QRS, we got a T wave, and then all of a sudden we have another P wave. So this, you can tell just looking at this, this is a heart rate that's normal, but it's awfully fast. Doesn't that look quick when you just look at it? So let's figure out the heart rate here. So I'm going to start with this line right here as my starting point. I'm going to label the next one as 300. My next one is 150, and the next one's 100. So this is just under 150, so maybe about 148 beats per minute. This is going to be C. This is our sinus tachycardia, so we have a regular rhythm. We just have it going really, really fast. So this one's about, what did I say here, 145 beats per minute. So this may be somebody who is exercising. This could be somebody who's dehydrated, has a fever, or also has heart failure. Alrighty? Next page. So let's take a look at this one. Oh, doggone it, I already gave you the answer down there. Well, not the answer, but the stuff at the bottom. So look at this one here. So this one is, if you're looking at this, when we say look at the overall rhythm, all right, we got like a long stall here, and then we got a couple beats, and then we got a long stall here and a couple beats. So this is kind of strange when you compare it to the other 2 or the other 3 that you looked at where we had a fairly regular, beat every couple of squares. Or every couple seconds, whatever it is you want to move it into. All right, so if you look here, flat, 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 and then all of a sudden we have a little P wave, QRS, our little rest, we have another P wave, QRS, another T wave, ventricles are resting, and then nothing, all the way along, and then finally the P wave happens. So we've got something here that's stopping the pacemaker cells in the SA node from firing. So this is what I'm saying. This is this long spot in here where we have a long leg in here. So this is taking longer than 2 seconds for the SA node to fire. So when you see you have longer than 2 seconds for the SA node to fire on here, and then we get a regular P wave, and then you get a normal heartbeat, and then again we get another little thing here. Okay, this would be D. So this is going to be our sinus arrest. So this is when you do eventually get a heartbeat, but in between there, for some bizarre reason, that SA node is not getting the message. So the reason the SA node might not be able to pass along its message, I shouldn't say it's not getting the message, it's not firing the message along to the nerves, which will tell the atria to contract. You can have diseases of the SA node. You can have sleep apnea. You can be on digitalis, which is a heart medication, and some antiarrhythmic drugs. So some of the drugs that you take to try to give you a regular rhythm, what they'll actually do is cause this sinus arrest in here. Okay, so obviously if the antiarrhythmic drugs are doing that, you're going to go and get them changed to different types of drugs. So our next one here, now this one, look at this kooky one in here. All right, so we've got sort of a normal heart beat in there, and then crazy, and then so this is 1, 2, 3.5, and then here's 2, and then here's a little bit over 2, and then another 3.5. We don't have any regular rhythm here. We've got this crazy bass line that's in here that's all chaotic. You can barely tell where the T wave ends, and then these crazy, are these P waves or not these P waves? Like you really can't tell what the heck is going on in this case here. All right, so if you look at the intervals, they're not rhythmical at all. They're not regular rhythms at all. They're longer, they're shorter, they're longer, all over the place. All right, so we have a chaotic irregular production of irregular QRS. So we have, it happens, it just is happening irregularly. So something is happening here that's not allowing the ventricles to contract at a regular rhythm. And we don't really have any P waves. We can't see any clear P waves in here. Are they even happening? What the heck is going on in here? All right, so this would be E. This is when you have atrial fibrillation. So what's happening with the atrial fibrillation is the atria are quivering. So, but the good thing about the atria quivering, which is not a good thing, but the better than having the ventricles quivering, is when the atrials are fibrillating or out of whack or whatever, you can still get a signal that being sent here to the ventricles, which is going to send the blood out to the rest of the body. So you're not, the ventricular fibrillation is like death unless you get this fixed up. The atrial fibrillation, not a good thing at all, but it's not quite as an instant death thing as the ventricular fibrillation is. All right, so this is about 145 beats per minute in that little section here, and then we've got another little section where it's 120. So the heart rate is quite fast and it's very irregular. So this could be caused by high blood pressure, somebody who's having a heart attack, somebody who's got coronary artery disease. This can be, sometimes people are born, they have a congenital condition that just makes their heart, their atria fibrillate, and there's some medication you can take for it and some surgeries that you can get for it. What they basically do in some of the surgeries is they form a little bit of scar, they go in there with a little, it's called ablation. So they kind of go in there and burn some of the cells just to sort of calm them down from, constantly fibrillating. It can be from hyperthyroidism, and it can be stimulants. Anybody who's ever drank a lot of caffeine, so like, quite a few cups of coffee or tea or the Red Bulls or anything like that, like you've overdone it on those, will feel that fluttering or that fibrillation. A lot of times it feels, you can almost feel it in the back of your throat. So that's atrial fibrillation. All right, and our last guy here, this one here. So this one's pretty obvious. We're pretty smart now by this point here. So if we're looking at our, our EKG, we get a little dinky P wave here, we get a wave, and then we come down here and look at the ventricles. They're underneath. We know that the ventricles are supposed to be up here. And if we kind of look in this little segment here, this isn't really that important for you guys to know, but you'll notice it's kind of deep, like it's not nice. This, like, look at here, it's underneath the baseline. So it's in the negative area of the baseline. It should be sort of up closer to the baseline there. Or even above the baseline, I should say. So this is in the negative thing here. So you've got a T wave that's going under, right? So this has a very distinct look for it. So make sure you look for this when it's on your quiz. If you see this little guy, when you see the T wave underneath, you know for sure that this is going to be this condition here. So this is G, this is ischemia. So this is where we have no blood reaching certain parts of the heart.